how can a patient know if they can skip MARPE and go straight to MMA surgery? That is, can we skip MSE, EASE, FME, Partners Custom MARPE, the orthodontic sort of mess that's involved with the MARPE, and go right to double jaw surgery, which is a one-day project. Things to consider: aesthetics, function. Aesthetics, let's keep it brief. Jaw surgery involves a Lafort cut that occurs right here, right sort of below your nose, above your upper teeth. That bone is cut off, rotated, moved forward. You'll notice that the cheekbones are not involved in that Lafort cut. Now, there is such a thing as a high Lafort cut, such as what Dr. Alfie does. This high Lafort cut is a little higher, but still beneath the zygomas. And I think an interesting question to ask is, where exactly does that high Lafort cut occur? I don't know, but I can tell you for sure it is beneath the zygomas. The zygomas are these bony little cheek protrusions that account for that nice angulation of the upper and mid-face. And with double jaw surgery, those bones are unaffected. However, with the MARPE, since the mid-palatal suture is split and the two halves of your maxilla cranked apart, everything upstream from each of those halves of the maxilla, which includes the cheekbones, will be expanded. You don't get a crazy amount of change in the zygomas, but it is noticeable. It was noticeable for me, especially on this cheekbone, and it's noticeable for almost every person that I talk to that does a MARPE. The cheekbones and, of course, the arch are the two places where you really see the aesthetic effect of the MARPE. Just yesterday, I was speaking to a kid in California who had a remarkable transformation in his aesthetics just from the MARPE. He went from being a very boyish-looking young Asian kid to basically looking like a K-pop star, especially after getting the K-pop haircut. By the way, hair is super important to looks maxing. Funny that the dude with the rat's nest is telling you about hair maxing, but I can tell you, though, a nice K-pop haircut mixed in with a little MARPE can really make all the difference when it comes to looks maxing. I digress. When you do an MMA surgery, so you're moving the lower third of your face, right? And that doesn't include the zygomas. And so when you move the lower third of your face forward, that actually exaggerates the extent to which your upper face is flat. So commonly, what jaw surgeons such as Michael Gunson will do is they will put cheekbone implants in along with the MMA surgery. But implants are implants. They are what they are, right? Whether it's a silicone implant or a bony implant, it's a kind of superficial treatment to the problem. Whereas with a MARPE, you're getting a true permanent skeletal bony cheekbone sort of implant. It's not an implant at all. It's just an expansion of the cheekbones. So doing a MARPE before jaw surgery can help offset the risk of getting that crocodile face where the lower third of your face is super advanced, but this part of your face remains flat. Maybe not so much of an issue for people that already have prominent cheekbones. And believe it or not, those people exist where they have bony cheeks, but are definitely recessed and are in need of an MMA surgery. Narrowness of the smile from an aesthetic point of view, it matters, right? Like if you're smiling and you have a narrow maxilla and you have the dark triangles, presumably after a double jaw surgery, you're still going to have those dark triangles in the corner of your mouth. You'll be lacking in a Hollywood smile if you don't transversely expand with a MARPE first, although three-piece segmentals do exist that can widen the maxilla along with surgery, but three-piece segmentals are rare, and that's kind of another point, really important point in this video, is a lot of jaw surgeons that are offering double jaw surgery, for many of them, the three-piece Lafort is not even an option. Three-piece Lafort being when they cut your maxilla into three pieces and widen it and advance it simultaneously as part of one procedure. Let's move on to discuss the real elephant in the room, which is nasal breathing, MARPE, and jaw surgery. Does jaw surgery improve nasal breathing on its own? Super important question. So Casey Lee very importantly said when he came on my JawCast podcast that he has done EASE on patients after jaw surgery because after jaw surgery they continue to complain about poor nasal breathing, and poor nasal breathing following jaw surgery is the number one cause of MMA relapse. Think about it. If you advance your jaws radically through a jaw surgery, but your tongue is not serving as a retainer to preserve that advancement because you're mouth breathing, because you're not able to nasal breathe, that is going to pose long-term stability risk for your jaw surgery. So it's critical that nasal breathing be excellent following a jaw surgery. Otherwise, it could relapse. And I can't think of a more of a nightmare scenario than going through with double jaw surgery, suffering the process, the recovery, the cost, only to have it fall back 5 or 10 years later. So then does jaw surgery itself improve your nasal breathing to the point that you don't need to worry about your nasal breathing after jaw surgery? Well, this is the elephant in the room. Paul Kociancic said MARPE is crap. Jaw surgery is all that you need to improve your nasal airway. I have heard of other jaw surgeons saying the same thing. Wallin and Relay at LA Comms are known for suggesting that MARPEs are overdone and that a lot of people really don't need MARPE and that they can go right into jaw surgery and that will solve all of their needs. I don't know whether that's true or not. I think that jaw surgery does improve nasal breathing, and the plumbing of that to me is a little bit unclear, but if you think about it, the roof of your mouth, the maxilla, is the floor of your nose, and when you cut that off with the Lefort cut and downgraft it and rotate it forward, the nasal volume is going to increase. But it's going to increase and I could be wrong about this, and please, if I am, clarify for me in the comments, but it's like taking an accordion and lengthening the accordion, but not actually widening the accordion. In other words, your nasal cavity is somehow getting like longer, but not wider. And so would that improve nasal breathing? Potentially. But would it improve nasal breathing as much as doing a jaw surgery with a MARPE? Because what the MARPE does is it expands the nasal volume in the width direction. It's on the y-axis, it's taking your nasal volume and it's going like this, whoosh, so that width is not only occurring at the base of your nose, which is probably what occurs with a jaw surgery. If any widening of the nasal volume occurs with jaw surgery, I presume it would be at the base of the nose, where the Lefort cut occurs, but not so much higher up in the nose. Whereas with an ease or with a well-executed MARPE, FME, take your pick, that widening is occurring along the y-axis going up into your nose, and also along the z-axis, especially with a posteriorly placed MARPE, so that if jaw surgery is giving you, let's just use an arbitrary number, 100 units of nasal volume improvement. Yes, jaw surgery is improving your nasal volume and therefore improving your nasal breathing. But what a MARPE or an ease is doing is giving you an additional 75 units or an additional 100 units so that the sum total of nasal breathing improvement when you do jaw surgery and MARPE is 200 units instead of just the 100 units that you're getting with the MMA surgery. In other words, my working hypothesis is that the ultimate nasal breathing improvement occurs when you do jaw surgery and MARPE. Does everyone need both? Maybe not. But for patients that present with distinctly poor nasal breathing, and this can be determined using rhinomanometry, which is a type of test in which a kind of sensor is placed at the base of your nose. And by the way, I need to learn way more about rhinomanometry, but I know that it's being done by Anil Rama, who's a sleep doctor. And Karen Davidson, I believe is her name, is an expert in rhinomanometry. Casey Lee is up to speed on rhinomanometry as well. So this basically measures scientifically the quality of your nasal breathing. And for patients that score really poorly on rhinomanometry tests and have huge amounts of nasal breathing resistance, I would think those are the patients that especially should consider a MARPE prior to jaw surgery, because they're going to want to maximize their nasal breathing improvement and make sure that they don't leave anything on the table with regards to how much they can improve their nasal breathing. That's really what it's all about. It's about maximizing. Maybe not every patient needs to maximize. They can skip the MARPE, skip the 2 years of orthodontics associated with MARPE, minimum 2 years, because God knows if the orthodontist told you it's 1 year, it's going to take twice that long because the expander makes a big mess of the teeth and cleaning that up is very slow process, and it always, the Invisalign stage of treatment always takes way longer than you would expect for reasons. Keep in mind as well that it is a lot harder to do MARPE after a jaw surgery, as following MMA surgery, you will have titanium plates holding your face in place, and those titanium plates are not meant to be packed with, okay? They're made out of titanium for a reason, and that's because they're supposed to stay there forever and hold shit in place. You don't want to stick a MARPE up into that and start blowing it open, as it's just a very messy chronology for treatments. Better to do the MARPE first before the plates are in your face. Use that 1.5-year orthodontic phase to get your teeth ready for jaw surgery as well, as there's definitely some orthodontic work in many patients that needs to occur prior to jaw surgery. Yeah, so patients with high nasal breathing resistance are the ones that should especially consider MARPE before jaw surgery. The patients that could probably skip MARPE prior to jaw surgery are the ones that have pretty decent nasal breathing to begin with, and especially that have really good bite to begin with, that don't require any pre-surgical orthodontics, as, I mean, those patients really, they can just go right into the jaw surgery, a couple hours, one day, boom, new face, and then ship it, okay? So answering this question is a little bit of a work in progress for me, but hopefully this video is a beginning to a longer discussion about this question, and I will leave it at that, all right? Hope to see more of y'all soon, and that's it for now. Peace out.